Hello and welcome to another episode of PodcastDX, the show that brings you interviews with people just like you, whose lives were forever changed by a medical diagnosis. I'm Lita. Ron is not here today. His son was in a karate tournament today and had a mishap with his elbow. They're at the ER, but our thoughts are with him, of course. Jean and I will be standing in for Ron today.
Yep, I'm Jean Marie.
Collectively, we're the host of PodcastDX, and on today's show, we are speaking with Cheryl Salazar.
Cheryl was diagnosed 3 years ago in 2015 with idiopathic pulmonary fibrosis. Cheryl is a 57-year-old mother of three, two of whom happen to be college students, and she is currently on SDI. She is a patient advocate, a patient mentor, and a support group leader, and community volunteer. She's a daughter, grandmother, wife, and sister. Oh. Cheryl, you sound like you're awfully busy.
Yes. Hi, Cheryl.
Hi, good morning, hello, or good afternoon, wherever you are.
Correct. We are everywhere.
Yes, well, hello.
Cheryl, what is idiopathic pulmonary fibrosis?
Pulmonary fibrosis isn't just one disease. It's a family of over 200.
Wow.
And idiopathic pulmonary fibrosis is just one.
Okay.
One of many. It's a disease in which tissue deep in your lungs becomes thick and stiff or scarred over time. And the formation of scar tissue is called fibrosis.
Okay. Over
time, the scar tissue can destroy the normal lung. And as the lung tissue thickens, your lungs can't properly move oxygen into your bloodstream. As a result, your brain and other organs don't get the oxygen they need.
Okay.
And this causes you to feel short of breath, especially like when walking or exercising.
Sure.
Sometimes the doctors can find out what's causing it.
Okay.
But in most cases, they can't find a cause. And they call that idiopathic, which means cause unknown.
Mm-hmm. Okay. And can you tell us what the typical symptoms? You said shortness of breath when you're exerting yourself and things of that nature. What are some other symptoms?
Absolutely. So, and again, it's different for everybody, but there are some similarities.
Mm-hmm.
The signs and symptoms, they usually develop over time. Sometimes they don't even show as a symptom until the disease has done serious damage and progressed to damage your lungs.
Okay.
Over time, you might feel short of breath, even at rest. The most common symptoms are shortness of breath, and at first it might just be a while.
Okay.
While you're exercising, or over time you'll feel breathless even at rest.
Okay.
A dry hacking cough that does not get better.
Okay.
And you might have bouts of coughing that you can't control. Sometimes there's gradual, unexplained weight loss, fatigue, achy joints and muscles. And as you can see, all these kind of mirror other diseases, so it's very
hard to diagnose. Right.
Sure.
Exactly. And another one is the clubbing, which is widening and rounding of the tips of your fingers or toes. And for me, it was memory loss.
Oh, okay.
And cyanosis, which is the blue tinging to the skin and the lips and the nails.
Okay.
Mm-hmm.
So, those are some of the consistent, similar ones that we seem to find.
Okay. Now, before you knew that you had it, you probably didn't even know what it was. Just like, at least I didn't know what it was until we looked it up.
No.
Could you tell us a little bit more about what led to the diagnosis?
Yeah, it was a long journey.
Okay.
Back in 2010, I began to have some shortness of breath when doing things like climbing stairs, walking my dog, riding bike, any kind of activity.
Okay.
Even talking. The doctors would check my lungs, say I'm okay, my thyroid, they'd run blood tests. And basically, I was led to believe it was all in my head.
Oh.
And that maybe I needed to exercise. I was getting older. I was getting older. I needed to lose a little weight. And I thought the same. So I was having a lot of aches and pains, but they were diagnosing me with bronchitis and colds and pneumonia and sinus infections. Then in 2014, I was having a lot of aches and pains, more so, especially in my neck, because I have some age-related arthritis, like many other people do.
Sure.
And I seen a chiropractor at the time as part of my management plan for my pain, and a physical therapist and my regular general doctor. So my chiropractor took x-rays of my neck because I was complaining so much about my neck hurting. Okay. And upon reviewing them, she saw a slight shadow on my lung. She, in turn, sent it to my general practitioner, who scheduled a PFT, a pulmonary function test.
Okay.
And this was the first of many of them. I then went through CTs, HRCTs, high-resolution CTs, MRIs, and finally I landed up with a lung biopsy. And this was mid-December 2015. So as you can see, it was a journey. It was hard to diagnose. It really ran its course as other diseases do. And so it was so similar, they could not figure it out.
Okay. When you went to the chiropractor, was that the first time that you had an x-ray that showed your lungs, or had they done lung x-rays prior to that?
That was actually the first time.
Okay.
Yeah, that was the first time. I mean, of course, when I went to the doctors with complaints of shortness of breath, and I was catching colds, and more often I was susceptible, they would listen to my lungs.
Right.
And, but they never referred me for any x-rays.
Okay.
And thinking about it now, there's also another common sign and symptom is you hear a rattling in the bottom of the base of the lungs, and it sounds like Velcro being pulled apart.
Okay.
And when the doctors hear that, that's pretty much an indication that it's IPF or pulmonary fibrosis. Okay.
So really, a really thorough listening to the lungs is vital. And I know you are an advocate of early diagnosis for this disease. So
I think that's I feel like early diagnosis is one of the things that we can control ourselves, and you need to advocate for it as soon as possible.
Sure. Well, Cheryl, the National Institute of Health states that doctors may prescribe medications, for example, may prescribe medications, also oxygen therapy, pulmonary rehabilitation, and even a lung transplant to help treat idiopathic pulmonary fibrosis. What treatments have you had so far, and what has helped you with this process?
So there are many treatments available,
right?
And you're overwhelmed at first, so you don't see that pulmonary rehabilitation can help you. It was one of the biggest helps for me. You don't feel like you can exercise because you don't have the oxygen to exercise. So how can you? Number one, I started pulmonary rehabilitation, and it was wonderful. It brought me out of my depression, my anxieties over this illness. It taught me how to breathe differently, use my different muscles, and strengthen myself, and exercise. Okay. So that was number one. If you can get to pulmonary rehabilitation, it's great. I also have supplemental oxygen, so I am on oxygen.
Okay.
With movement, I have a portable oxygen, the concentrator that I take with me, and I'm able to fly now, which is amazing. I never thought I'd be able to do that. So I just recently got back from England and Ireland and Wales.
Cool.
Yeah, it's amazing. I really thought I was done with flying. I do support groups. I really feel that helps me talk to others who feel similar concerns and confusion and go through the symptoms, and I learned so much at them. Weekly mental health therapy. I have my own personal therapist I see every week just to deal with my mental health issues, because it's traumatizing to find out that you're diagnosed with something there's no cure for, and basically a 3 to 5 year lifespan. I take antifibrotic medication, which has slowed down my progression. I'm stable at the current time, which is amazing.
Yeah, that's great.
Antidepressants help me, and acid reflux medication, definitely, because I was encountering a lot of that, and they are thinking that can contribute to scarring of the lungs.
Sure.
And then diet changes. I've changed my diet a lot. So those are just some of the things. There's a lot more that you can do, but those are the changes that I've made, and it's helped. It's helped a great deal.
Okay. And have they talked about possibly, would you be a candidate for a lung transplant, or is that something?
I would be a candidate, as far as I know, for a lung transplant. I have spoken to my doctor, and his feeling is that I have quality of life right now.
Okay.
I'm out and about and doing things.
Right.
And that when it comes to that point, that I'm really not able to leave the house or really have any quality of life, even though my numbers may be low right now. He feels that would be the time to start with the testing, because there's so many tests that you go through just in order to get ready for this lung transplant.
Sure.
And as far as traveling, that's out of the question because you have to stay close for all these tests, and it could take up to 2 years.
Right, and you're just waiting for.
And just a hint on the whole transplant thing. If you ever get to that point, or if you know anybody that is, did you know that registering in more than one region, the UNOS region, will increase your odds of getting the transplant greatly? You just have to be able to get to that location within 4 hours. And if you can do it, you can register in every region. And that's how, celebrities and things end up getting there so much quicker. It's not like they buy them, but the fact that they have...
Thank you for that.
Yes.
No, thank you for that. I did not know that. And I'm pretty thorough on most things. I never heard that, but thank you very much for letting me know that.
Yeah, our cousin had a liver transplant last year, and she was on a waiting list here in Chicago area for over a year, and she was not doing well at the end. And we happened to be in North Carolina, Jean and I, and we made friends with a person in the rental house next door, and they were there for a liver transplant from Boston. And I said, you don't have transplant surgeons in Boston? She said, oh yeah, we do, but you get them much quicker here in North Carolina at Duke.
Right.
And so we looked, I couldn't believe it, but I looked into it, and sure enough, it was true that they are doing a lot more at Duke because that's what they specialize in.
Well, and also based on your blood type, people as they migrate and move, they might settle in a specific area. So your specific blood type may be more common in a specific region or area.
But it is legal to register in every region, or as many as you want, so you can do that research if the time ever comes.
Well, and Cheryl, you said that you had made diet changes. What sorts of diet changes have helped you, or have you found helpful?
Well, less alcohol drinking.
Okay.
Like no wine. I love my glass of wine with dinner. So since that was creating heartburn, much less of that. Tomatoes, for example, tomato sauce. I've really cut most of that out because, again, it causes heartburn for me.
Okay. Eating
dinner late at night is a biggie for me, and going to bed right after.
Okay.
And I'm a midnight snacker. I like to snack in the middle of the night. So I've cut that out. Okay. And really staying away from sugars, to be honest.
Okay.
And that's a tough one. I have a sweet tooth, but it's helped me a lot.
All right, good.
And do you monitor your blood oxygen levels with a pulse oximeter or something comparable?
I do.
Okay.
I do. So I have one on me at all times. I have one in my car, one on my oxygen machine next to my bed, which I use to sleep with, one in my portable machine that I carry along with me. And, I'm getting better at guessing myself now. I can actually feel the change in me.
Okay.
And I'll throw my oximeter on, and I'm pretty right on with it, guessing where my numbers are. So I honestly try to wear my oxygen and use oxygen as much as I need it. But there are times when I'm at home that dragging around a 25-foot hose becomes very cumbersome.
Mm-hmm.
So I will take it off and sit without it for some time.
Right. Well, standing in for Ron again, he was going to ask you, what tips do you have for someone recently diagnosed with pulmonary fibrosis?
My goodness, I have so many.
I want to hear them.
Yeah. It's okay. My number one thing was it's okay to grieve, really. I felt a lot of guilt at first. I don't know why, but did I do something? Did I bring this on myself? Was it any of my, did I partake in this? Is it something I did wrong? Then I was very sad, and I grieved for the person that I used to be. I could no longer do things I used to be. So in doing that, I recognized that I really needed to get some emotional and mental health for that.
Sure.
So I did. I advocated right away for myself. I found a center of excellence, lung clinic. UCSF is one that I went to. You have to immediately find a center of lung excellence. Pulmonary Fibrosis Foundation, went to their website and found out all the information I needed and found out where my support groups were located close to me. Pulmonary rehab is an absolute must. And again, the Pulmonary Fibrosis Foundation has all of the rehabilitation centers around the country. They're such a great resource. And I get their email updates. Get into the pulmonary rehabilitation ASAP. It really saved my life. I can now live with it. Get a second opinion. Okay. I definitely advocated for a second opinion because there are so many pulmonary fibrosis, interstitial lung diseases that it can mirror other diseases. So you need to get a second opinion. Make sure you have not just a good relationship with your pulmonologist, but a great one. If not, find a new one. I'm on my third right now.
Oh, wow. Okay. So that's important.
Yeah. It's so important to have that communication and be able to talk and really find out what your options are.
Okay.
I have a wonderful pulmonologist, and in fact, just a little side note, whenever I see him, we Skype with my father who lives in New Zealand.
Oh, okay.
And this is every single time because my dad wants to be involved in my health.
Of course.
And know what's going on. And he will even say, "How's Dad doing? Let's call Dad up."
Okay, that's great.
He comes and speaks to my monthly support groups that I lead. Okay. He's amazing.
Wow.
So, and it took a while. It really took a while. My very first pulmonologist who diagnosed me looked at me with the diagnosis and said, "Go home, be kind to each other." Oh. I can't tell you anything else. And that was what I was left with. And I was stunned.
Mm-hmm. They didn't see the world traveler that you are.
Yeah.
Yeah. Then the go-getter.
No.
And, yeah. Okay.
Yeah, not at all. So that, finding that pulmonologist, finding the right one, it did wonders for me. I felt some support. I didn't feel so alone. And he discussed the antifibrotic medication, which my other pulmonologist hadn't. And that is key right there. If you can get on an antifibrotic, first thing, it will slow down the scarring. Nothing's going to stop it,
right? But
it can slow it down.
That's great.
It amazes me that you kind of in the back of your mind, you think that every doctor is going to have the same answers or be able to handle it, and it's just not true. We're all human, and like you said, just keep looking for the right one.
Exactly. And, a lot of them don't know about, like your general practitioner would not really know about pulmonary fibrosis.
Right.
When I go to the emergency rooms, which, it's probably a couple times a year, to be honest, I have exacerbations where it kind of flares up.
Okay.
They have no idea what I have. In fact, they ask me, "How long have you had cystic fibrosis?"
Oh.
Well, I don't have cystic fibrosis.
Right.
So they haven't been trained in it.
Right.
They don't know what to look for in it. And this is a disease that, it takes so many lives.
Yeah. Well, I'm glad you're joining us today to not only provide us with the information and help our listeners identify the signs and symptoms, but also just restating what we strongly believe in, that you really have to be an advocate for yourself.
Right. And
that you can be the most dynamic and really person when it comes to your own healthcare, that you're really going to be the one that makes the difference.
Yeah.
Right.
Totally.
And Cheryl, it sounds like this has been a particularly difficult diagnosis to get. You mentioned the depression. What has helped you work through these rough patches?
Again, I've really, I work with my therapist. I attend a support group. I advocate for early diagnosis. I work with the Pulmonary Fibrosis Foundation. I've become heavily involved and realized that I have to be my own advocate. I have to take care of myself, and I have to treat myself as I would a friend.
There you go. There you go.
And we noticed that you are a friend and advocate for others as well. We noticed that you've had GoFundMe pages for other patients with idiopathic pulmonary fibrosis as well, which is just amazing.
Yeah, thank you. Yes.
And
yes.
I understand that this disease is a lot to handle and a lot to deal with. Do you have any other diagnoses that go with this or that haven't been exacerbated by this condition?
I've had things along, like most people have along
Sure.
my life's journey. I've had hypothyroid, and it swung to hypothyroid, Graves' disease. Chronic depression and anxieties have really come about with this diagnosis.
Sure.
I have arthritis, but most people, I want to say over 55, have a little arthritis somewhere.
Yeah.
Yep.
So I don't attribute that to the disease. There is a little chance that I maybe have rheumatoid arthritis, and there's blood work being done on that, and that could actually be a cause of the pulmonary fibrosis.
Oh, okay.
We don't know.
Right.
We don't know.
Right. More research needs to be done.
Right.
Well, what else would you like our listeners to know about this particular diagnosis?
Pulmonary fibrosis is progressive, and it can't be reversed. It affects about 1 out of every 200 adults over the age of 60.
Oh.
That translates to more than 200,000 people living with IPF today.
Wow.
Right?
Wow.
And 50,000 new cases are diagnosed each year.
Wow.
As many as 40,000 Americans die from IPF every year. And there is no cure.
Wow.
No cure.
Never knew.
No. And, I've learned that I'm not my diagnosis.
Sure.
I live with IPF. It's not who I am any longer. I grieve for the life I had and the activities I miss. IPF is an extremely lonely prognosis disease because you don't appear sick.
Mm-hmm.
You just don't. People look at you and they'll say, are you feeling better?
Mm-hmm.
No.
Don't you? Jeez.
Yeah,
I know.
It's an invisible disease.
Yep.
So it's the entire family that's diagnosed. It's not just the patient.
Okay.
The caregiver, they need help. They need to reach out also.
Sure.
The earlier that people are diagnosed, the earlier they can receive help, an antifibrotic, and slow down the progression.
Mm-hmm.
But it's also been a blessing. You really appreciate life and people. I never would have met some amazing people that I've met or traveled to places I've never been, like Chicago. Never been to Chicago.
Have you?
But I now go back and forth.
Oh, okay.
Oh, okay.
Good. You'll have to stop by and visit us one time.
Yeah, I found a passion and a light and a purpose and a strength that I never knew I had, really. And for that, I am so grateful. I'm so grateful.
That's perfect. Well, Cheryl, thank you so much for joining us today. We really appreciate you sharing your story. The energy that you give, even in your discussion here, is just, I could tell that it's a blessing for you, that you're really living life to the fullest.
Absolutely. And Lita and Jean, I really appreciate you giving me this opportunity to just spread the word and advocate for early diagnosis.
Absolutely.
Yes. For sure.
And I will note that when you serve in the armed forces in the United States, before you are retired, they automatically do a lung X-ray. It's
required.
It's a requirement. So at least for that population, they can maybe identify early signs and get treatment early on.
Right. There's a lot of movement happening now with IPF, and it's exciting to see. I mean, there is no cure in the near future that we see, but there are treatments, and there are now apps that you can track your own health with, and you're able to monitor air quality outside.
That's great.
Little things, your blood oxygen level, even the Fitbit, how much you walk in the day.
Right. All of these things help us improve our life.
Absolutely. Sure. And your lungs are just one part of it. You do have your mechanics of all your other organs and body that can help you take on some of that.
Okay.
And one last note, there's a great book out there, and it's written by Dr. Noah Greenspan.
Okay.
And he actually has a group. It's the Ultimate Pulmonary Wellness Center. He's in New York, I believe, but he has a book out and a website, and he's amazing.
Okay.
And he has a Facebook page, and that I would recommend anybody to go there. It's a daily thing. You can talk to people if you can't make it to a support group.
Okay. We'll put links
something
for
like that.
Yeah.
Yeah, we'll definitely put links for that.
for that on our website.
Oh, yeah. Okay. Yeah, it's amazing. And again, the Pulmonary Fibrosis Foundation has webinars you can check out. They have people you can speak to one-on-one. You can call them up and talk to a counselor online. They have live webcasts that you can sign up for. So there's a lot that's going on that people don't see. And when you're first diagnosed, you go to Google. You Dr. Google.
Sure.
And it's one of the worst things you could do because you're told that you have 3 to 5 years.
Right.
And that's what sits with you and resonates with you. When you know what, you have You can make it longer. You can do it yourself. You can advocate for yourself. It's going to go the way it's going to go, but you don't have to let it bring you down. You can still live with it and live a quality life with it.
Oh,
yes,
thank you.
Yes. And we wish you the very best in your continued treatment, Cheryl.
And let us know the next time you're in Chicago.
Yes, for
sure.
We'll
take you for lunch.
Oh, absolutely. I did know that's where you guys were located, but I will reach out to you next time.
Awesome.
Super.
We look forward to it.
Yes. And we're gonna close this down.
Thank you.
All right. Well, thank you very much, Cheryl.
All right. Thank you.
Have a good day.
Have a good one.
You
and Happy
too.
New Year
so
and a safe New Year.
Thank you. And I hope his son, Ron's son, is going to be okay. Hopefully.
Yes, I hope so too.
Yeah.
I hope so too.
All right.
Thank you. Take care.
Thank you so much.
Bye-bye.
All right. Bye-bye.
If you have any questions or comments related to today's show, you can drop us a line at podcastdx@yahoo.com, through our website, podcastdx.com, on Facebook, Twitter, Pinterest, or Instagram.
And if you have a moment to spare, please give us a review wherever you get your podcast. And as always, please keep in mind that this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified healthcare provider with any questions you may have regarding a medical condition or treatment and before undertaking a new healthcare regime, and never disregard professional medical advice or delay in seeking it because of something you have heard on this podcast.
Till next week.